Assalamu alaikum everyone, and good evening. I hope you're all doing well, and I hope you're all having a very blessed Ramadan so far. And whether you're praying, you're fasting, you're or some way somehow able to juggle your studies throughout this month, we just want to say thank you so much for joining us here tonight. My name is Maryam Isa. I'm a fourth year medical student, and I'm more than excited to host today's session. Tonight, we're going to dive into a rather very overwhelming topic for a lot of medical students, which is the US surgical residency match. And for many students, this topic seems like a never-ending maze. You keep hearing about it all throughout your 5 years of medical school. You will hear from seniors about like interviews and programs and electives they went through and research years and just a bunch of overwhelming stuff that make you feel like it's kind of almost impossible to match into there. And all of that aside, it being a surgical pathway or surgical, residency, it's just very, very competitive field. And that's exactly why we started Mastering the Match series, where it's an initiative aimed at guiding the students into the whole application pathway and hopefully help demystify the whole process, specifically from a couple of Faisal graduates themselves. And tonight, inshallah, we're going to focus specifically on general surgery in the United States. So please help me welcome our two esteemed guests who will guide us throughout the process today, which is Dr. Safwan Abbasi, a PGY-1 General Surgery resident at Mayo Clinic, and Dr. Abduzubida, PGY-1 General Surgery resident at Brookdale University Hospital. Thank you guys so much for being here with us tonight. We truly appreciate you taking the time to join us here. And lastly, just to give you guys a little bit of structure into how the talk is going to be, we're going to start with a couple of guided questions where our esteemed guests are going to take turns into answering them. And then we're going to have like a Q&A segment where we're going to open the floor for you guys to ask whatever question you want. So if you want to unmute or if you want to drop your questions in the public chats, please feel free to do so. And with that being said, please let's dive straight in. Now, let's start with Dr. Safwan and then Dr. Abdurrahman with the first question. Could you please briefly walk us through your path into matching into general surgery, and what do you think made your application competitive? Dr. Safwan.
All right. Assalamualaikum everyone. I'm Safwan. I graduated med school, i.e., I finished internship in 2023. And then I applied for the general surgery match. I matched into preliminary surgery at the Mayo Clinic, Rochester. In 2024, in March of 2024, I started my preliminary year in residency in June of 20 or July of 2024. And then, preliminary surgery is a temporary 1-year program. And so I had to reapply for a categorical position in general surgery in September of 2025, and then match into a categorical position here at the Mayo Clinic again. So I was lucky enough to stay in March of 2025. And kind of the way that preliminary surgery works is typically if you end up matching into a categorical program, which is a 5-year program, you more often than not have to do the first year of residency again. There's only a few places where they bump you from a prelim 1 to a categorical 2. But we'll talk about those options later down the line as well during this talk. But that's kind of the brief journey that I had to go through, and I kind of the year between graduating and matching prelim surgery, I worked as a TA at the clinical skills department at the university. I did not do any research years. In terms of kind of things that I did, kind of out of the way to, ensure that I match into general surgery, I would say is my away rotations. I did 4 months of away rotations in my last year of med school, which is my internship year. And 3 of those were in general surgery related stuff, and then 1 was just neurosurgery, which was kind of unrelated to my ultimate pathway, but it just helped me gain perspective on things that I don't want. And I think that's kind of the segue into talking about what made my application stand out was were those aware rotations. Um, I was able to get letters of recommendation from really good writers who were able to observe my performance as a med student on the service, and were able to vouch for me. They were luckily also kind of known names in the field, and so that helps a lot as well in getting interviews when you apply with those letters. Um, Apart from that, I will say, you know, my scores were fairly competitive, but I will follow that up with the fact that, most people's scores these days are competitive. Everyone gets, a 250 or more in step two. But at the time, I would say it was definitely on the competitive side. And then the last thing I would say is my involvement in education throughout med school. That was kind of my clutch. I was not big on research, unfortunately, during med school. So things that helped me help my application at Propel was probably, in terms of kind of extracurriculars, would be the kind of the education involvement. So, I was a PAL teacher. There was a program before your guys' time. It was called BLSP. I taught in that, taught in every pre-med there was every single year. I was a TA. I gave a few lectures to, like the clinical lectures to third year med students. Yeah, so I would say those three things made my application stand out would be my involvement in education, my aware rotations, and in connection my letter writers, and then my competitive-ish scores. Thank you.
Thank you so
Assalamu
much,
alaikum,
Dr.
everyone.
Yeah, go
Yeah,
ahead,
go
Dr.
ahead. Sorry.
No, no, go ahead.
Thank you. Assalamu alaikum, everyone. My name is Abduzubida. I'm currently a PGY-1 at Brookdale Hospital. I'm a preliminary resident, and I'm applying to this match. And I totally agree with Safwan on multiple aspects when it comes on how to become a competitive applicant in matching in general surgery. Safwan, he raised multiple points that, as he said, we will be dissecting more later down the line during this talk. But if I would say one thing, um, it's not, first of all, we have to acknowledge that all of what we achieve is directly from Allah subhanahu wa ta'ala. It's all by His blessings and grace that we both matched, and we have to keep this in mind because لَإِن شَكَرْتُمْ لَأَزِيدَنَّكُمْ. That we have to keep that in mind. Now, a few things that make my application, let's say, competitive or stand out is my electives. So, if you want to match in general, not just in general surgery, you don't have to be stellar. You don't have to be perfect in everything. You don't have, oh, I have to have like great, spectacular scores. I have to have million researches. I have to have a research fellowship and a million electives. No, you don't need all of that. You need to find your niche. Safwan, mashallah, he was speaking a lot about educational activities. He focused on one aspect and he did not screw up like the other aspects. Same goes for me. I focused on one thing, and for me, it was my electives. So when you go, or something that they care about during your application is your electives, and how many electives you did, how many months you spent in the US. They usually look for 2 to 3 months as a minimum. And the most perfect scenario is if you're a US graduate, you would do all your electives in the US one full year. But one, let's say a cutoff where you actually stand out by doing electives is the 6 months cutoff. If you have 6 months or more in the US, then yeah, your application stands out from that aspect, from the aspect of electives. And I did that. I did 6 months of surgical electives in the US during my final year. Now, when it comes to matching in a preliminary year, matching in a preliminary year is the most likely scenario for international graduates. And to be honest, I think it's not that competitive. It's not that hard to match into a preliminary year as long as you don't mess up those, like, let's say, the crucial steps, اللي هي step one, step two, doing few electives, one or two researches. You don't need a lot. So yeah, you just need to find your niche. Now, the real deal is finding a categorical spot. And I initially thought, since I'm here in the US with a valid visa, when applying for a basically applying for a categorical spot, I would get more interviews. I was shocked. I was wrong. I was shocked. Last year, I got 10 interviews. This year, I only have four. Still a good number, yes, alhamdulillah, but it was shocking for me that you get less interviews after doing your preliminary year. So it's much, much more hard. Now, Safwan said something about the LORs. Yes, LORs, they matter a lot. You have no idea how much this is important. When you are doing your electives, you have to do your best and you have to, let's say, test the waters, see who's writing you this letter. Is he someone who's a big name? Is he a good writer? Because unfortunately, one of my LORs, like I worked with one of my attendings during my prelim year before application for 2 months. Because, like you start in July and you finish your application by the end of September. I worked with him for 2 months, and everyone was telling me he's a good writer. Later on, I was shocked that the opening statement of the LOR he wrote me was, I did not work with Abdurrahman much. That was his opening statement. So, yes, you have to be careful who writes you the LORs. You need to do your best to make sure that they write you a good letter, and they have to be um, a relatively known name. Now, when it comes to the step two score, I think step two score, yes, it's very important, especially if you want to match a categorical spot. But as long as you score, I wouldn't say above 250. I would say, because now the average for step two is 250. I think if you score something above 258, that would be the ideal because there is a standard error in the steps, and it's 8 points. So essentially, what that means, let's say I took my exam, I scored 250. This means if I take the same exact exam again, I have 8 plus and 8 minus digits. So if I take the exact same exam again, I may score something between 240 to 258. So in reality, when someone, a program director or someone looks at your score, they see you just exactly at the average. They know, okay, maybe he's not really an average scorer. Maybe if he takes the exam again, he will score below average. So if you score anything above this 8 digits, then you're in the completely safe side. But obviously, again, anything above 250, you are considered relatively in the safe side. That's at least that's what I believe, and based on asking around and even inside my program.
Thank you, Doctor, so much. That was a great insight into it. And now moving on to our next question, which you guys kind of already touched up on it. Um, how important do you think are the board scores now? Specifically, in the past, step one is now pass and fail, and now you feel like there's more pressure on step two. So how do you feel like how valuable are the scores now?
Um, I will say kind of in the initial years after step one became pass fail, that was, a big thing. Everyone was really focused on step two, and everyone is really focused on step two now. And as Abdurrahman has said, the average is 250 now. And so, anyone who's thinking of applying into, let's say, a surgical specialty will have a good score. So I will say most a lot of programs now actually use the step two score as more of cutoff instead of using it as a, a positive point towards, ranking that applicant into accepting them into their program. That being said, um, the the fail rates of step one are uptrending as well. So I will, at the end of the day, and this is kind of going to be the theme, and throughout this talk, is your application is looked at in a holistic manner. It's not one thing that matters more than the others, okay? And as Abdurrahman has mentioned, you pick out your niche and you portray that in your application. And so if your score is not that great, if it's less than 250 or it's kind of around the average, then you make it up for that with other aspects of your application. In summary, I will say yes, the board scores are more important, understandably, it's kind of a logical thing. But because everyone's getting all these really good scores now, everyone's you log into LinkedIn, everyone's getting 260s to 270s sometimes as well. And so I in my opinion, again, there's no data that I've looked into, but I feel like programs are more using it as a cutoff. They're using a score cutoff instead of, saying, oh my God, this guy's, a 260. I should probably add that as a positive point. Of course, if you get a 275 or 280, I think that's something stellar out of the ordinary. But other than that, I think now the focus has shifted to other parts of the application.
So Abdulrahman, you want to add something?
I totally agree with Safwan that now like the board scores are more of like a um I wouldn't say filtration, but something around those lines. Like if they see you're above their own cutoff, whatever any program they choose their cutoff, um, uh, that's essentially it. They look at, are you above that cutoff? Okay, you are in the pool for a possible interview. Now, when it comes to step one, this is very important, guys. After step one became pass and fail, as Safwan said, the fail rates are uptrending. Even in the in Al Faisal community, I heard from multiple people from Al Faisal failing step one, because it's just they're trying their best. Okay, let me. It's like a checkbox. I want to get it off the off my checkbox or off my list of things I have to do, so I can focus on the more important stuff. But this is detrimental, guys. We know this from before. A good score in step one correlates positively with a great score in step two. They're correlated. So whatever you put in step one, it will definitely help you in step two. So don't take it lightly. Study well for step one because it will help you in step two. And something more important than that, fail in step one is way worse than scoring 290 in step two. So this is very important, and I'm speaking about that from data from the NRMB report of 2024, something that they put the highest when it comes to the like the importance. Any failed attempt in the USMLEs, um, uh, it was the second most important thing in deciding that this person gets an interview or not. It's the second most important thing. The most important thing was I believe it was the COMLEX exam. COMLEX exams, those are for the DOs, so we don't do them. So essentially, for an IMG, the most important thing is a previous fail in the STEPS exams. So please, please, if I would say something, study well for step one because it will help you in step two. And you don't want to risk failing it from the first place.
That's great. Thank you so much. And it only makes sense that you work on your foundation really well, because even like if we focus a lot on step two and didn't that much on step one, I feel like the journey would be harder. So like if you just put it, and you put everything from the beginning, it will just be an easier, inshallah, journey for all of us. Okay, now moving on to the second question, Dr. Abdulrahman. Um, just a second. Okay. How much research is actually necessary for general surgery? And do you think that programs value quality more than quantity, as they say?
Um, no, the first part of the question, how much research is actually necessary? Not a lot. During my first application last year, I only had one publication and it wasn't the best. And I had two research or two poster presentations and two other researches that were on the way of getting published. Um, and they were not of the best, let's say, quality. So yeah, my research experience back then, it wasn't the best. Yet, alhamdulillah, I matched because again, alhamdulillah, it's from Allah subhanahu wa ta'ala. But the second thing that it tells us, it's not that important in a sense that as long as you have some experience, you have the equipment, they just want to know, can this person do a research on their own? You can showcase that during the interviews. You can speak about your research experience in a sense to show that, okay, even though I have one research publication, but I know how to do research. That's what they want to know. Now, the second aspect of your question, you said the quality versus quantity. Yes, that's very important. Quality knocks quantity like crazy. You have no idea how important quality is in research. Obviously, if you have like a lot of research, like 50 and above, this will stand out. But those small, let's say, or the very little RCTs, if any, that would be of great quality and it will stand on its own on your application, which is very hard. I don't think anyone from Al Faisal is working on an RCT at this point. I'm not sure, but if anyone is, that's great. You should finish that as soon as possible.
Great.
Uh,
Yeah. Go ahead.
I will kind of just echo what Abdurrahman has said, and again, I'm not, as I said earlier, I'm not at least I haven't been, probably should be, a big research person. Um, but your involvement in research is all what they're looking for. Okay. So the number doesn't technically really matter. If kind of go on all the match data and you see the numbers, right? You're going to be, if you go under kind of the IMG tabs and you see the mean number of research experiences. And research experiences in your application includes abstracts, includes poster presentation, includes publications, and also, unless they've changed it, includes what is it called? Things that you have submitted or are pending publication, essentially, whatever that's called. Again, you can clearly tell I'm not a research person, right? Um, and you will find that for the mean number for these research experience for the people who match into for the IMGs who match into general surgery is 22. That's a lot of research, experience. But that is an average number. It is not looking at a single applicant, it's looking at a pooled number of applicants, and it's an average number. So they have totally ignored for this particular number all the other experiences that an applicant has who match into general surgery. And that being said, as long as you have a few publications, a few good ones, or even a lot of bad ones, as long as you show interest in research because that's where everything is headed now, I think you should be good. And when it becomes more important in terms of quality, in terms of having the numbers, is when you apply for fellowships after you finish your 5-year general surgery residence. And even for that, for some fellowships, it doesn't matter, and for some, it does. Pediatric surgery, you need the numbers. Surgical oncology, you need to have, you need to have, done research during your residency. And most often than not, all the research that you did from med school doesn't matter for fellowship applications as much as the research that you do during residency matters. So as long as you have a couple of publications, a few poster presentations, you've showed interest, I think you should be good, honestly, from a research standpoint.
Perfect. Thank you guys so much. Now, Dr. Safwan, moving on to the next question. What part of your application do you think the programs cared about the most and what like stuck out the most?
I'm sorry, I have to go back to the last question because I feel like that's a question that a lot of people have. I don't know if there's a question that will come in this thing, but um, whether or not you need to do a research year, okay, that is entirely up to you whether, from a logistical, from a financial standpoint, whether you're able to do that because most research positions, unfortunately, are unpaid in the US. And so whether or not you want to do a research position is entirely up to you. Okay. If you have a few publications in your pocket, you don't necessarily have to do it unless the rest of your application is pretty terrible. You have bad scores, you have you have no electives, you were not able to do elective for whatever reason. In that scenario, I might say it might be reasonable to look for a research position. Again, as I said, most of them are unpaid, and it's hard to get one to begin with. Um, but if that's what you have to do, then I'm if from an individual standpoint, I'm happy to talk about it with you if you want to reach out. But it's absolutely not necessary to do research years. I know people who did 3 years of research, dedicated research, after graduating med school, they matched still into a preliminary position, and when they applied again, they did not match at all. So, the it's just a part of your application, okay? And matching from a preliminary into a categorical position, I would say it's more based on your clinical performance rather than anything else. And we can talk about that later as well.
Perfect. Thank you so much. Now the other question. Do you like to answer, Dr. Safwan?
Oh, sure. There's also a couple questions in the chat.
Yeah,
Do you want to
we can
address them?
answer them now or like towards the end in the Q&A
Uh,
segment.
Oh, we can do it in the Q&A segment then.
Okay.
What part of my application stood out the most? So I've applied twice, right? Um, and I would say it's different things both times. The first time, as I said, was probably my letter writers, because I personally think I was, alhamdulillah, was able to perform well on my away rotations and was able to impress the attendings and the consultants that I worked with. And more importantly as well, I was able to be a good part of the team because the attendings letter, they'll write your letter, right? But if residents, mark you as a red flag, then you will not get an interview at that program. Okay. And so I think that would be a part of my application that stood out the most the first time around. And the second time around, just being a preliminary resident, that's a year of clinical experience that any program would look for in a categorical resident because they're essentially work ready when they come on in July if they've done a year of preliminary residency. So I would say those two things for those 2 years.
I totally agree with Safwan. The first application, they cared most about my away rotations, especially that was my niche. Um, so the thing is, every single interview, they would be asking me about that one or two specific letters. And apparently they were really great letters, and they just kept asking me about them. So yeah, the first time you're applying, they will care a lot about your letters of recommendations and your experience in the US. The second time, again, as Safwan said, it's just the fact that you're doing a preliminary year. They would be asking you, if inshallah everyone gets like great interviews, they'll be asking you, what are you doing as a prelim? Are you actually operating, like doing work inside the OR, or you're just observing? And they would ask about something it's called the ABSITE, the American Board of Surgery intern exam. And they care about your score. This year, unfortunately, the score came relatively late, like on the 28th of February or the 27th, and the rank list deadline is on the 4th of March. So programs didn't have time to interview those high scorers in the app site. But yeah, I totally agree. I have nothing to add other than what Safwan said.
Perfect. Thank you guys so much. Now, Dr. Abdurrahman, what is one mistake that applicants frequently make when they're applying for the US match, specifically in general surgery?
Okay, that's I think this goes back to what we discussed earlier when we said everyone thinks, oh, I have to be a spectacular applicant from all aspects, like a well-rounded applicant. A well-rounded applicant does not mean you're scoring 270s and you're done with step three and you did 100 researches and million electives. No, a well-rounded applicant is someone who's scoring average. He's not messing up everything, but he has one aspect that he stands out like a niche, essentially. Um, uh, Now, another thing that they commonly, like a common mistake during the US match or the application, is how you sell yourself on the NRMB application. Filling that application should not start on 1st of September, not at all. You should start filling your application and preparing for it the moment you know that I'm applying this cycle. You're applying this cycle, you should start working on your application, how you're gonna um, uh, like uh, describe your electives, how are you gonna describe your research experience, the way you write your personal statement. You have no idea how much they ask you about that. They ask you about your electives, what you did. They would be telling you, "Oh, I saw you wrote this thing, this that thing in your description of that elective, or you wrote this thing in your personal statement." So the way you write up your application, I think it's very important, and I think it's overlooked by many applicants just because, oh, they will see that I did this elective. No, they don't just look where you did the elective or what elective you did. They care about the description. And something that Safwan actually, he told me that last year, because I applied 1 year later after Safwan, he told me numbers never lie. In your description of your electives, mention numbers, how many patients you've seen on daily basis, the fact how many operations you joined. I was doing trauma surgery, how many trauma codes you ran, how many laceration repairs you performed, stuff like that. Numbers never lie. You should always mention how many weeks, how many patients, and all sort of numbers to be mentioned in the description of your elective.
Right. When it comes to general surgery, I think the and I speak for myself as well, is that um, being extra hopeful that you'll match into a categorical position just because you had a couple of categorical interviews, which represented about 20% of the total interviews that you had the first time around. Just based on trends, you will, if you are applying to general surgery as an IMG, you will most likely match into a preliminary position. That is the truth, okay? And both me and Abdurrahman can say and vouch for the fact that the preliminary year is an extremely stressful year, okay? You start in July, okay? And then you have to submit your next application for a categorical position by the end of September. Okay, so that's July, August, and September. 2 months, maybe another month of September. And in these 2 to 3 months, you have to gather new letters, okay, because you can't be applying with the same letters. If you are a preliminary resident, you should have letters of recommendations from your current institution vouching for your clinical abilities as a resident, okay? And that's difficult, you just sometimes don't get a chance. For me, like, speaking from experience, the you know the first rotation that I started with when I came on as a preliminary resident was an acute care surgery service, which is, it's the consultants are, they're on call based schedules, and so it's difficult to work with somebody enough for them to be able to vouch for you. But luckily, I was able to find someone, and she wrote me a good letter. And so this uncertainty is very difficult. Okay. That being said, you're reapplying, so there is the financial burden of reapplying. As a IMG, one of the other mistakes, and I'll just kind of cue this in right now, is that people apply narrowly. You need to apply broadly, okay? I applied, let's say, 100, 150 programs to get 4 interviews. And if I was an American medical graduate, I would probably get much, much, much more than that. And so that's the other thing, right? The financial burden of reapplying. It's getting expensive year by year, okay? And the yield is not that much. Um, um, and then all in all, kind of vamping your application, your personal statement to reflect your current, status as a preliminary resident, all the while you're doing clinical duties when you're working, oftentimes up to 80 hours a week is difficult. Okay. And this is something that a lot of people do not anticipate. And you cannot ignore this fact that you will have to go through this if you want to go into general surgery in the United States. Okay. That being said, there's people who match into categorical positions right off the bat, and they're great. That's excellent. It's rare. Okay. Um, so that's one thing. The second thing people underestimate is the competitiveness of the whole general surgery realm, right? People say general surgery, so they think it's kind of the general. No, it's not. It's a surgical, it's a 5-year, very hardcore training program, after which you can go into multiple surgical subspecialties, and it's competitive. If you look at the number of internal medicine positions that went unmatched last year, or in 2025 was like in the hundreds, right? There was only 4 categorical positions that went unmatched in general surgery. That being said, they also underestimate the difference in competitiveness between prelim and categorical. So as Abdurrahman had mentioned, the number of interviews he got this year were significantly lower than he got last year. And that's normal. That's just the way it is, right? You are still an IMG regardless of whether you're not in the US, whether you're on a visa, whether you're a preliminary resident, you still have that IMG, unfortunately, trademark. And if you look at the number of unfilled positions for preliminary surgery, it's like 100 something, but only 4 for categorical general surgery. So it is, the 5-year general surgery program to get into is highly competitive, and people underestimate that, and they take things for granted, and they're not proactive about making their application stand out for a competitive specialty. I'm not saying it's neurological surgery or interventional radiology, but it's up there. You know what I mean? And if you compare, the match data of Al Faisal University, most people go into internal medicine, right? Only in the past few years have people ventured out and gone into other specialties, right? And so you look around and you see all these people matching into internal medicine, and you're like, oh, I'll match into general surgery just fine because everyone's matching, right? That's not the case. It's a different specialty with a different competitiveness rate, different requirements. Okay, it's much more hardcore, hands-on than internal medicine, and more kind of you have to work more essentially. And everyone works in all of residencies, but I will say, categorically speaking, surgical residents work more than medicine residents in terms of, the number of hours they're up and about, the number of hours they spend in the OR, the number of kind of late hours that they have to do to get through their, through their residency. I think, those are some of the mistakes that that people make when considering general surgery, in addition to some of the stuff that Abdurrahman had talked about, not having good letter writers, and that applies to any residency, not specific to general surgery. And then lastly, I would say, with most interviews being remote, people don't prepare for them well enough. They think, because it's remote, I can wear my shorts or my jammies down below and have a suit and tie up here. And it's just going to be just fine. You're not in that mindset to have a formal, serious interview if you do that. Okay. And so under preparation for interview was, again, one of the mistakes that I did when I applied the first time around. And I have done one, I will say just one in-person interview my second time around, and it's a completely different ballgame, right? You're sitting right in front of the person who possibly could be deciding your future. And if you have that mindset when you're doing virtual interviews, I think that's best instead of, taking it not so seriously just because it's across a screen instead of, across the table.
If I may add, Safwan raised very important points. Now, when it comes to expectations, as he said, you have to prepare your mindset that the most likely or the most probable outcome is that you're matching in a preliminary position. I had 10 interviews the first time applying. Six of them or seven of them were categorical. Only three of them were prelim. Yet I ended up matching in prelim. So it hit me like a truck. I thought, hey, I'm well set, all is good. I have seven categoricals, I will match categorical. And it just did not happen. So you have to set your expectations right, otherwise you will be hurt. Initially, I was hurt, but then I realized, okay, everything happens for a reason. Inshallah, what's best for me. And it was, alhamdulillah. And the second thing, I learned not to set my expectations high. I learned the reality of how competitive general surgery is. And this is what you have to keep in mind. You work, you do your best, but in the same time, you are real, you're honest with yourself. Now, something about the interviews, I went through the same mistake that I did not prepare well for my first interview. And I sat there and they were asking me questions and I just did not know how to answer. One important question that almost all programs ask is the ethical questions. Tell me a hard decision or a hard patient that you met and how you handled them, a conflict you had between a colleague and yourself, or a conflict you had with an attending. So, in reality, during your electives, it's going to be rare that you face such instances, but you will definitely face one or two. And if you don't write them down, from the moment that those things happen, you will not remember them when you start interviewing. So whenever you face such an ethical dilemma, like or a difficult patient, make sure to take note of it because you will use it during your interviews. Otherwise, you will not be able to remember it when you are preparing for interviews, and then you will have to lie about a scenario, which I do not recommend doing at all because they will ask you a follow-up question and then your lie will crumble like a cookie. Okay, the moment they ask you a follow-up question, everything will shatter and you will look, I wouldn't say stupid, but you will look, your lie will show. Okay, so don't ever do that. Don't lie in your application because the moment they ask you a follow-up question, everything will crumble.
Thank you, doctor, so much. You truly have come a long way. Dr. Abdurrahman, following up, what do you wish, or looking back, what's something you wish you have known before applying or before starting your residency application process?
So it's very different for me because if anyone knows, I applied as couples matching with my wife Zahra. Alhamdulillah, we matched medicine and surgery. So my application is very different. I don't know if you guys like, I can give a talk about couples matching maybe in the future because on its own, this is a whole different topic. But I think we touched base on the things that we wish we know, like the setting your expectations right, and preparing for your interviews and for your application in general from an early on. I wish I did that better in my first application. Um, and if anyone is thinking of applying as a couple, make sure you guys sit together and set your goals right. Like, is your goal to just match? Is your goal to match in the same city, in the same state, in the same hospital? Because all of these things, they will you will have to change your rank order list accordingly. So it's like big and tough decisions to be made, but eventually you will have to make those decisions. But yeah, I think we touched base on the things I wish I knew before applying. I have nothing to add.
Um, I would just add one more thing, and just that's purely from a logistical standpoint, is, the visa situation. Okay. I know things are very, very up in the air right now, but when I applied back then, things were more stable. Okay. So I cannot speak for current circumstances. I have no experience in current circumstances, and, I can't answer any questions from that standpoint. But again, going into prelim year, you have to consider the type of visas that you're on, okay? And if you have a green card, if you have a US passport, that's excellent, okay? But for most of us looking at Al Faisal's demographics, it's probably not true, okay? Um, that being said, the two main visas that we have are the J1 and the H1. Okay, people love the H1, and again, now it probably is not going to be offered anymore because of the hefty fee that comes with it. But again, I can't speak for that because I haven't read into it. I'm not on an H1. And then the most common one is J1. It's sponsored for by the ECFMG, the Educational Commission for Foreign Medical Graduates. This is the body that takes care of you, when you come to the US, essentially, as a foreign physician, foreign graduated physician. They've been processing your step one score, step two, step three, your visa. They've been part of your residency applications, and so they're kind of the liaison between your home country medical school and your US residency institution. And most of the time, people come on a visa that is sponsored by them. If you look into the terms of the J1, it's kind of a difficult visa to have. But if this is what you want, if you want to do a residency in the US, unfortunately, most of the times that's what you'll have to end up being on. Okay. And for the most part, it's not bad. It has allowed people to come into the US and be trained in the US, and there's further avenues down the line that people can explore. But specifically for a preliminary resident, right? Because it is a 1-year program, you only have a 1-year contract that does not renew, okay, unless you stay in that same program. And so when you apply again, if you don't match into a categorical position, the next step is to look for a preliminary PGY-2 position, which is again it's a thing. It's not a new thing, sorry. It's a thing where essentially it's another 1-year program, which you can do, but then you'll have to reapply again at the end of or during the PGY-2 preliminary year. It's just another 1-year contract, but instead of treating you as a first-year resident, they treat you as a second-year resident. So that's one thing that could happen. If you don't match, if you don't match it to a categorical position after prelim position, you can go into prelim PGY-2 positions. But if you don't even get that, the other option is to do another prelim PGY-1 position, which unfortunately is not possible with a J1 visa. The terms of the J1 visa is that you have to progress in your training. Progression from a prelim to a categorical position is possible, but progression from a prelim to a prelim position is not real progression. You're repeating the same thing again, and that is, again, not possible. So, if you don't get any of these, the other option is, there's other options that you can explore. You can do a research year, you can switch to a research J visa. You can do a clinical fellowship in, let's say, a non-operative surgical critical care fellowship. If you weren't able to match into a residency position. But I've seen people not getting any of these things, right, after a prelim year. And their only option is to go back where they came from. They have to go back to and again, for us, it will not be going back to Saudi Arabia unless your statement of need is from Saudi Arabia. It'll be going back to your home country, whether it's Lebanon, it's here, it's Pakistan, it's India, wherever. And that has to be for at least 2 years. Okay, you have to show that you've been in that country for 2 years. It's an exchange visitor program, and if you don't match, that you have gained all that you need from an exchange visitor perspective, and now you have to go back to your home country and put it into practice and use it essentially. And that's kind of the whole point of a J1 visa. And so you have to this is another thing that I wish I knew before applying. I mean, I knew it, but I felt like I wanted to ignore it. Okay. Again, as Abdurrahman said, you have to set your expectations. Okay. You will most likely match into a prelim position. You will most likely be on a J1 visa unless you have US citizenship or green card or any sort of other status in the US. And if you don't match, if you don't find another position at all, period, no prelim, PGY-2, no research, no fellowships, nothing like that, you have to go back to your home country. And that is very scary because, you've done all of this and you have to go back to Pakistan where I haven't lived for a long time. I mean, I go there to visit once in a while, but I haven't lived in Pakistan, for a very long time. And so, for a lot of us, that's true as well, right? I mean, how many of the Jordanians here have lived in Jordan for the past 10 years, right? And so that is another thing that I wish I knew before applying. It's a reality that some people have to go through. I personally know people who've had to go back to India or Nepal after not matching just because they were not able to secure any other positions here in the US. And that's a scary thing, but it's a risk that you have to take if this is your goal, if you want to do general surgery in the United States as an IMG who has no legal status in the US.
MashaAllah, Safwan, he added a lot of points of discussion. Now, like more information are coming to my head. One thing I want to clarify further, I think Safwan explained it, but I just want to clarify. When he says you go to your home country and do 2 years, this means the country where you got the statement of need. Wherever you got the statement of need from, this is where you have to go and practice for 2 years. So back in the past, we used to take the statement of need from Saudi Arabia, and most of the residents they would take it, they would apply to the US, they go to the US, and they cancel their iqama. So they have no way to go back to Saudi. And if, God forbid, one of those people do not match and they do not find any positions whatsoever, now they are obligated. The only possible solution for them to go back to the US is if they go back and practice in Saudi Arabia for 2 years. So you get into this, like, it's a muddy situation to say the least. So if someone is gonna issue their statement of need, the best thing is to issue it from a place you know you can go back to just in case things go south. Another thing is, I'm gonna speak from a Palestinian perspective because I am Palestinian. I'm not allowed to enter Palestine to start with. I've never been to Palestine. I'm not even allowed legally to enter Palestine. So some of my colleagues, they issued their statement of need from Palestine, and it was very easy for them to do it. It was issued in like 2 days or so, which is let's say a record because Safwan knows how hard it is to issue a statement of need in general. So yeah, if someone is from Palestine and they issued their statement of need from there, just keep in mind if things go south, you're not allowed to go to Palestine, just like my case. You'll be in a very tough situation. You will not be able essentially to go back to the US and train there. Now, when it comes to the visa, Alhamdulillah, I am on an H1 visa, and things I wish I knew before applying. Safwan and I, we are from the same batch. Safwan, mashallah, he finished his step two and he applied the same year he graduated. That did not happen with me because I went directly into my electives without finishing step two. And I wish I knew how important finishing step two before starting my first elective it is. It's so important. During electives, you will be busy. You want to impress people. You want to get letters. But in the same time, you need to finish step two exam. This is not feasible unless you're like Superman, Superwoman. From my standpoint, me and my brother, as well as my wife, the three of us, we were not able to study for step two exam during our electives. We used to do like 100 hour a week during our electives just for us to impress people and to gain as much knowledge, as much as great letters, so on and so forth. So this is my advice. If anyone is going to electives, try your best to finish step two. Otherwise, I did 6 months of electives. I came back in September to Saudi Arabia with no step two exam. I could not take it. I had to wait for the next cycle. I had to wait for 1 full year. Another thing is, I wish I knew, is how easy finishing step three is after step two. After step two, I studied for step three for 3 weeks, and Alhamdulillah, I scored well. And during the process of obtaining a J1 visa, that was back in June last year. قدر الله وما شاء فعل that my J1 visa got rejected. My program was gonna kick me out. The only, let's say, safe line for me is to apply for an H1 visa. And alhamdulillah, the H1 visa worked out. Had I not taken my step three exam, this would not be an option because one of the prerequisites of an H1 visa is finishing step three exam, being certified, like I wouldn't say fully certified, but eligible to get a general license in the US. That's one of the things, or one of the ways to put it, essentially. So yeah, I wish I knew how important finishing those exams early on, how important that is. And that's my advice for everyone. Like, try to finish them. If a program is offering you an H1, that's awesome. But as Safwan said, that's very highly unlikely because of the $100,000 fees. But it's an option for you to explore.
I will follow up, you guys are, you joined this talk and, thinking about, all the things that you have to do to match. And, you would have never thought that visa would be, or logistical things or financial things would be, any of your concern at all. But unfortunately, that's the reality. But I also want to kind of reassure you that it's very possible. Okay. Everyone does it. Everyone has to go through it. It's kind of the reality of the situation. But you should also know that you have great seniors like myself and Abdurrahman to help you out, and many others to help you out in whatever specialty that you want to go into. And, it works out for most people. And if it doesn't work out right now, by Allah, it's not the thing that's best for you right now. And that's okay. Okay. So don't be overwhelmed by the things that we've been very recently talking about in terms of the visa and all that. If you're an earlier med student, focus on all the other stuff that we've talked about: step scores, electives, research, extracurricular activities. Forget about this for now, because who knows, tomorrow there might be a different rule that, none of us are savvy to. And so focus on the other stuff, just wait for all this visa stuff to, calm down or be more clear. But also know that this is all everyone has to go through it, unfortunately. So.
And I see a lot of questions in the chat about the visas and statement of need. As Safwan said, guys, focus on the basic stuff. The first step for you is to take step one. The second one is step two, and then getting your ECFMG certificate whatsoever. Those things are the important things. We usually every year, Al Faisal, like graduates and the upcoming, let's say, residents, the upcoming batch of residents, they form a group called the Match 2026 or Match 2027, whatsoever. And then we will be able to help with the statement of need and the differences between the visas and all these technicalities and logistics. For now, as Safwan said, just focus on the important stuff. That is your research, electives, and steps.
Great. Thank you guys so much. Alhamdulillah, على كل حال, inshallah, like visa stuff will be resolved, inshallah. Isa. Moving on to our last question, for Dr. Abdurrahman. Can you share what you guys already touched up on this, but can you share what your interview experience overall was like and what stood out the most about general surgery interviews in your perspective?
So my interview process or experience, interviews in general, they're a very, let's say, stressful period, especially if you're a resident, like you're trying to finish all the clinical work you have, and then the next day in the morning you have an interview that you did not prepare for. For someone who's applying for the first time, that would be different. You will have more time to prepare. And usually in the same match in the group that we make, we start sending what is it called? Like tips and tricks on how to how to do well in your interviews. We offer also some let's say training sessions, mock interviews with the current applicants. So that's very important to do because we'll be able to give you feedback on how to do well during your interviews. And as I said earlier, you need to prepare for them early. You need to anticipate the questions from those interviewers. You need to write a pitch about yourself, like literally um, sit down and start introducing yourself. Who are you? Where you graduated from? How good Al Faisal is, how it's highly ranked, and what you did or what you did in the past, what you're currently doing, and what you look forward to do in the future. So those, in general, what I see is an important aspects of an introduction. Um, any interviewer will ask you, introduce yourself. So you have to put these into perspective. Um, Another thing is when it comes to the experience of the interviews themselves, some interviewers, they like to do a panel in a way that they're interviewing three applicants or two applicants at the same time. This is very important and it actually made me stand out. So let's say I'm a program director, I'm interviewing three people at the same time. I ask the same question to three different people. So every single applicant will be answering their own questions. But what I did, and I noticed that it made me stand out, is whenever an applicant answers their question, I would touch base on their answer and try to make it as a discussion. Oh, you mentioned you did this. I don't know, you mentioned you're an equestrian. Tell me more about that. So we shifted away not too far away from the interview into an actual panel and discussion. And this made me stand out in a way that they saw that I'm not just here to answer my own questions, but I'm actually socializing and my social skills are great. I'm listening to what other applicants are saying and I'm showing interest in what they're saying, even though we are actually competing, for the same spot. So sometimes this happens and it's a great way for you to show your social skills. It's a great way to show that you're someone who listens. Um, and I would say that I was highly, let's say, applauded for such a thing that I did.
All right. Most of my interviews were virtual. And I think a thing that really helped me, tackle all the questions that are asked is making a Word document, uh, with all the possible questions. And to be very honest, there aren't too many types of questions that you'll be asked. It'll be iterations of the same questions over and over and over again. Um, but having a little bit of structure in my answers, at least on a Word document, helped me. And I'm not reading from this Word document when I'm in an interview. Okay, this is just for my preparation, for my background. Um, in fact, I will say that in one of my very, very early interviews, the first time I applied, I did read from some of the answers, but I wear glasses, so it kind of shows sometimes in the screen that you're reading something, and even if you don't wear glasses, it just shows that you're focused on something and not the camera. And that was terrible, unfortunately. Okay. So don't do that, but this is just for you, okay? So all the possible questions, including, all the behavioral questions that they ask, what's your superpower? If you were an animal, what would you be? they're not interested in the, the gross answers. They're interested in, what you make of your answer, if what superhero, and, why would you like that skill to be, how would you like that implemented in your daily life and your life as a surgical resident? So all of those, behavioral questions are really important as well. And you can all find these questions online. They're very, very widely available. And as I said, most of the questions that you'll ask will be iterations of the kind of the same 10, 15 questions. That being said, the another important thing is to know what you've written on your application. So, there's the ERAS application that you submit. Know your researches, know your experiences, and I will share this one little thing. One of my experiences, or one of my points on my CV that is as I was a TA, as a teaching assistant at the clinical skills department, and one of the skills that I mentioned that I taught was putting in chest tubes. Okay, I had not taught that, but it was on the docket for clinical skills. So I was like, okay, I'll just write it in my CV, because if I haven't done it now, I'll probably do it in the future at some point. And one of the thoracic surgeons at a very, very prestigious institute asked me, can you please walk me through placing a chest tube? And I've never placed a chest tube. I've never, I've theoretically, Dr. Atif's lecture on, like, that safe triangle or whatever, I've, grossly run through it, but I've never actually done it. And you can't explain it. You can't teach it unless you've done it, right? And so that was a, big whammy, because I could not explain to him, to a thoracic surgeon, how to place a chest tube. And I'm trying to, make all these intercostal spaces that don't really exist, and, trying to walk through, clearly putting it in the spleen or the liver, right, based on where my landmarks are. But, that was just a good teaching moment that, you have to, a well-prepared interviewee is one that knows all the things that they've put forward in their application, as well as just answering some of the other questions, because they can pick you out on anything. Okay. And one thing that people have trouble talking about, and myself included, is the researches. I'm sure your name is on a, you're the 25th author on a paper, right? That, got because you knew the 22nd author, right? And if they ask you to talk about that paper, and if you don't know, the important points and what came out of it, then you should not include it on your application. Okay. So if you want to include it, then you have to know about it, and you have to know how to talk. You have to be able to talk about it. I can also share, like, an in-person interview, because I was lucky enough to have one of those. And it's very different. You're right in front of the person. Every single part of your appearance matters. Okay. So your shoes have to be polished, your tie has to be right and all that. But one thing that helped me really in across virtual and in person is just be relaxed. Okay. Then, because nervousness can easily show, you might be trembling words, your thoughts might be, here and there. And so that really shows. And one of the best ways that you can tackle that is by doing mock interviews with your colleagues or your seniors. And as Abdurrahman said, we're happy to do that when the time comes. Yeah, I would say these are the things that stood out, some of the mishaps that happened with me, and how I learned from them. Yeah.
If I may add something about the research experiences, even though this rarely happened, it only happened with me once, but it's something to keep in mind. So I was well read about all my application, with the exception, like, I only had superficial information about my research experiences. So I had this interviewer who was very heavy and hands-on on research, and he was asking me, tell me the inclusion and exclusion criteria for this research publication. Tell me what was the let's say the significance, was the relative risk, what was the odds ratio. So he went very deep into that research and was asking me a question after a question about that specific publication. So I wouldn't say you should know all of these, but if you worked on that research, you will have an idea. You will be able to give an estimate. You will be able to give a range um, or at least if this was positively correlated or negatively correlated, you know? So it's just, again, if you don't know something, as Safwan said, don't put it on, or don't even lie about anything in your application. Another interview I had was someone who asked me at least 6 questions about my personal statement. It was 6 paragraphs. He asked me one question on each paragraph. He took 3 of my electives and asked me 6 questions on each one of those 3 electives I did. So it's very important for you to know what you wrote and you're truthful about it. And in the same time, to know exactly what you did because you lived it and you're the one who's writing this application. Theoretically speaking, you have to know everything about it. So yeah.
Right. That's all from our side about the guided questions. Thank you guys so much. Now we have a couple of questions from the audience. I would read it out, and if you guys, whoever wants to answer, can go ahead. Is that okay? Okay. So the first one is asking that given that many IMGs matched into excellent programs last year, but were unable to obtain visas, how concerned should we be about the visa barriers affecting our ability to start residency if we match? They really want to hear from a perspective of someone who doesn't have like a green card or a US permanent residency.
Um, I would say one thing, and we touched base on that earlier, that don't be concerned about visas right now. If you think that your, let's say, home country is too restricted and they have the visa ban on them, um, and you're most likely not gonna match, if you think that way, you will face problems elsewhere across the globe. So if the visas is the only thing that's stopping you from studying for the steps or pursuing the US career, I don't think that's, let's say, a good justification to not taking your shot and applying to the US because first of all, studying for the USMLEs will help you to pass the other board exams of any other country, whether it's the BLABS or the MCQQ of Canada or the Australian exam, the New Zealand exam, you know. So studying for the steps helps you elsewhere. And in the same time, I think keep tomorrow's problems for tomorrow. Focus on what you have to do right now. Right now, you have nothing else to do but studying for the steps. So, because it will help you across the globe. So, might as well just take them if you want to, or if you have the possibility of, or you're thinking about pursuing a career in the US. That's the way I think about it.
I 100% agree with Abdulrahman. You know, as he said, and I quote, keep tomorrow's problems for tomorrow. You know, if you're a third year medical student, don't worry about visas right now. You are 3 years out from applying. Okay. Of course, if you are an intern, you know, by Saudi perspective, or you know, you're a fifth year medical student, you know, now is the time to start thinking about, you know, the avenues of residency for yourself. I will say that, you know, applying and not getting it's a big bummer, not just from, from an emotional standpoint and, you know, from you know, the standpoint of, you know, not having a job or not being able to train, but also from a financial perspective. Okay. If you want to apply broadly, and I will just give this a rough number, you should be looking at anywhere, you know, upwards of 4 to 5 thousand reals for that application for that one cycle. Okay. And if interviews were to be in person, then that's added cost for travel. Okay. And so if you feel like, you know, if, and again, this is, I'm talking specifically to, you know, the higher year med students and the interns who are applying very shortly or have already applied. If you feel, well, I guess that doesn't apply to them, but if you feel like, you know, it's something that is hopeless, you know, it's that you should had, you've been hearing bad things, you've been hearing, you know, bad experiences of people, you know, spending all this money and all this time and all this effort and not matching, then look somewhere else. Okay. It's not the end of the world. There are other countries where people train in general surgery. You know, there's the UK, Australia, New Zealand, Canada, and they might be more feasible for you. That being said, know that all the efforts that you've done in, passing step one, stellar score in step two, excellent research publications, multiple electives, they are not all in vain, right? They'll still be useful in other places. And so, you know, unfortunately, at one point, you just have to, end up being realistic. Okay. But also know that a lot of the, kind of the visa and immigration situation is very volatile. So it can change on a daily basis. And don't let that just be the one thing that holds you back from applying. Okay. We're all adults now, and so it's reasonable to kind of have that kind of moment of introspection and be like, I'm done with this. I don't want to go through all of this, and I want to apply to the UK or Canada instead. And that's totally fine. You'll still be a surgeon at the end of the day. And I think that's totally reasonable. But if you're an earlier, third, fourth year med student, don't worry about this right now. Just focus on getting all the steps done and doing all the extracurriculars and research, and focus on your, university academic performance as well. And then once the time comes, we'll figure it out. Okay.
If I may add something, it just like, I don't know if it's an intrusive thought, but when you are choosing a career, you have to understand, you have to try the career, you have to try surgery to know if you like it or not. And if you tried medicine, if you tried pediatric and surgery, and you would be standing there, you'd be like, okay, I like all three of them. I think in that case, you should not go to surgery. If you like something else other than surgery, don't go to it. I'm not trying to put you down or tell you surgery is tough and no one will make it or whatever, but that's the reality. Surgery is actually tough working in it. And if you like something else, if you're in a bad rotation during your surgery intern year, you will start thinking, oh, what if I applied medicine? What if I took that pediatric position? And you'll start having some regrets. I think, and that's my personal belief, if you like something else other than surgery, or let's say, let me put it this way, if the only thing you like is surgery and nothing else but surgery, then go for it. I think that's the way I think about it, and that's my belief. Like, I like nothing but surgery. I hate internal medicine. I hate any other specialty. I want to do surgery for the rest of my life, and that's why I'm in it. Um, Another question, someone sent me a private question. I'll just read it. So, do you think 3 to 4 months of electives are still valuable? Because 6 months won't be feasible for me. Yes, 3 months is sufficient. So the way I see it is someone who did 1 to 2 months, someone who did 3 months, and someone who did 6 months. So those are the cutoffs you need to look at. 1 to 2 months, okay, you have some US experience. It's not the best. Ideally, you should have three. And the best case scenario, the next cutoff is having 6 months in the US. 4 to 5 electives wouldn't add much. They would, but in a time period where all programs are looking for cutoffs, oh, he did 3 versus 6, they would not think much about 4 to 5. At least that's the way I see it. So yeah, if you're able to get three, then get three. If you're able to get six, that would be your next goal. I don't think you should aim for something between 4 and 5. Obviously, the more the better, but where does it significantly stand out? I think at those cutoffs, 3 and 6.
Great. Circling back to the visa situation. So like for these fifth years of interns, they're like, what are their options aside from like, going broader within Germany or whatever, yani? Aside from the US, yeah.
Honestly, I defer this question because I did not explore anything but the US. Obviously, I have like just superficial information that Germany requires to know how to speak Deutsch. I believe you have to be B2, I think.
That's
Um, And for the UK, nowadays, my understanding is they're trying to restrict internationals, and you have to have the BLABs, BLAB 1 and BLAB 2, and to be GMC registered. But other countries, I have no idea. I'll defer the question.
Same here.
All right, no problem. Thank you, guys. Moving on to the next question. They're asking about the research and publications. Must they be surgical in the surgical field?
Not in my opinion. As long as you demonstrate, presence in research, it doesn't have to be surgical. None of mine were surgical, actually.
Yeah.
Agreed,
Right.
same thing.
Okay. Um, Someone is asking for internship, we have to complete 8 mandatory non-surgical rotations. How would you recommend I approach that I want to complete 6 electives? That if I want to complete.
This, okay, this question, okay, we're being recorded.
We'll have
So,
to go offline for this question.
whoever wants the answer, they can text me. But in general, we stand by the rules of our university and the Ministry of Health, and that's where I stop.
Okay, let's keep it to the end then. طيب. Um, if you had a chance to start medical school again from day one, how would you structure your path to maximize your chances of matching into a US residency, especially in terms of research, electives, and USMLE preparations?
I would start my USMLE preparation earlier. I think it's totally feasible, totally, possible. Unfortunately, when I did it, it was still score, and so I was really focused on the score. But now because it's pass fail, not that I'm minimizing the importance and the difficulty of it, especially with the uptrending fail rates. But it should be, try to get it done by your third year if you can, or early fourth year. And as Abdurrahman mentioned, you have to finish your step 2 before you go for your electives, because by the time you come back, you will be exhausted and you won't have time to do for it. And you might have to wait another year to apply. Um, let's see, electives, you just have to be very proactive in looking for electives. Start looking for them let's see, at the end of your fifth year. Start looking into places that you can go for electives. Most of them, yeah, sure, the applications won't even be open for another 6 months to even a year, but have that portfolio at the back of your mind, so when the time comes, you can easily apply without any issues, and know of the requirements as well for electives, because they have all these medical requirements that you have to have all these vaccinations, and that should be done as early as possible. Yeah, and I think now, as things are more open up, I think there's a lot more options for electives than it was in my time.
I would disagree from one aspect, which is start applying by the end of fifth year. That's actually the ideal situation or let's say the logical answer. But there are some hospitals or some schools where they're just waiting for you to finish your step 1 exam. And it won't harm you if you start sending emails as soon as you're done with your step exam. The main requirements for any elective is you're in your final year of medical school. And the second thing is you're done with your step 1 exam. So if those are ticked, you can just start sending emails. Um, and sometimes even if you are in fifth year, because the final year of medical school is actually the internship, so سنة الامتياز, that's what they call final year in the US terms, but in Saudi we call it internship, which is confusing because in the US internship is PGY-1. So do not, when you are sending emails, don't ever label yourself as an intern. No, say I'm in my final year of medical school. That's very important. And if you're in the beginning of fifth year and you're already done with the step 1 exam, just start sending emails. Tell them I'll be in my final year starting in July 2026, and I am looking for possibilities of doing an elective. And don't even call it an elective. Sometimes it's better for you to label it as an acting intern or a sub internship, so they actually give you that. And we had a talk. My brother and I, we delivered the talk about electives and the difference between an elective, acting internship, sub-internship. Um, in general, you're always looking for an acting internship. Acting internship is the highest type or the best type of an elective. It's where you are dealing with the patients on your own. You're essentially a PGY-1, but you're called an acting intern. You're called a student. They should be giving you all the roles and the responsibilities of an intern, a PGY-1, and you directly report to your attending. You don't even report to the interns or the residents in the um, hospital. The second one is a sub-internship where you're doing the same thing, but you're essentially reporting to the interns, the residents, and then you will have still some possibility to actually present in front of the attending and the consultants. A general elective. Yep. So the thing is, sometimes they use it interchangeably, but if you want to go by the book, that's the differences between them. And the general elective is just as long as it's hands-on, you can go with it, I guess. But that's something to keep in mind, I guess.
Perfect. Moving on to the next question. Someone is asking about what is the statement of need as a definition, and if it's needed or required for all subspecialties, or this is just specific for GS.
Yeah, it's required for all specialties. It's essentially a paper from the home country or the country you're living in, uh, stating that we are sending Abdurrahman, for example, to do surgery training, and he will just stay there for the period of the training. And once he's done, he will come back to us. And it's only needed for the J1 visa, which nowadays it's the main visa that the applicants are going to be on. That's basically it.
Right. And another question was asking about how valuable is being a TA in your application for residency.
You know, so let's say you graduate medical school in June of 2026. Okay. If you want to, if you're ready for it and you want to apply that same year, you'll submit your application in September of 2026, right? And then you won't hear back until March 2027, and then you won't start your residency if you match until June 2027 or July 2027, right? So there's like almost a year between finishing or graduating med school, i.e., finishing your internship and starting residency. And you have to fill that up. You can't have a blank space on your CV, right? And doing a TA position is, it's great. It's convenient. I don't know how things are nowadays in terms of, how easy people get in, but it used to be fairly easy, if you're a good, kind of academic record to get in. It's a good filler, good working hours, and teaching, you're educating medical students. It always stands out on your CV, always a good thing to have. But I will say, if you're able to get what we call a service residency position, essentially, like a general practitioner position, I would say that would be preferable because you're in a clinical environment, and um, I would say most, if not all, programs prefer to have a clinical kind of filler than an education filler. That being said, either is fine as long as you have something, to show for. It's not required, okay? Nothing is required. But if you want to stand out, then that's what, those are some of your options. And the third option is that you do a research position in the US or wherever. And as I said, that's totally up to you and the specialty that you're going into and whether you're able to find and fund it. But those are the options that you have.
Another thing is if you are going for a clinical, let's say a general practitioner, service resident, um, it's important to know about the timing. So definitely, yes, you will get higher pay and it's better looking in your CV. But the time, the hours, my brother Abdullah, he did service residency in surgery before matching, and we never saw him essentially. Like he had the long calls and yeah, so it's more time consuming, but it's obviously a better payment and it looks better in your CV. When it comes to being a TA, much, much better working hours, and the pay is 7,000 riyals, which is still a great thing. So yeah, just keep that in mind.
All right, perfect. All right, so
If I may add, I had a question in the private, sorry.
yeah,
It's
go on.
what's the financial point of view of applying for residency? How much does it cost? Someone mentioned financial burden of applying. So applying to the match, it is expensive. The pathway to the US is all expensive. And Safwan can also add to that. Like taking step one exam, that's like 4,000 riyals. Step two exam, another 4,000 riyals. Step three, a third 4,000 riyals. Going there to the US, just the taking a flight ticket to go to start your residence, your electives, that's, I don't know, 4,000 riyals to go to the US, a round trip. Doing some electives, they actually are paid electives. So especially like the high Ivy League programs like George Washington, that's like 7,000 riyals, $7,000 a month. Um, Stanford, they offer you an observership for 4,500. Harvard, I believe it's like $4,000. So yeah, those are expensive. And matching or the match application, the ERAS application, the NRMB application, those are a different type of expensive. So every single program you apply to has a fee of like $30. So if you just do a quick calculation, let's say you applied for 200 programs and 200 times 30, that's like $6,000 just for the application itself, let alone all the different things that I just explained from steps and electives, so on and so forth. So yes, it is expensive, but in the end, you're investing in yourself. Money comes and goes, but education, that's something, you're investing in yourself in the end. And inshallah, with God's grace, everyone get to go through the process and do well, inshallah, without a high burden, ya Rab.
I will say the university does offer, reimbursement options, if but you have to have good academic record for that. And so it's something that you can certainly explore. I was alhamdulillah able to kind of reimburse all my elective costs for 3 to 4 months through 2 cycles of reimbursement. And just know that that's an option for you. That's a resource that you have available.
Yeah, some great programs like Mayo Clinic, Cleveland Clinic, what else? Washington University in St. Louis. All of these are for free. Most programs, most electives are actually for free. If anything, you're just paying like application fees, which is $300 or so. And the university makes sure to keep receipts of all your electives, flight tickets, housing, because the university, inshallah, will reimburse you. So it's called ISEP program, the International Clinical Electives Program. Under them, they have funding, 8,000 riyals a cycle. So if you get both cycles, that's like 16,000 riyals. At least that's back on our timing. Another thing that you should be aware of is anyone who's an intern right now, they know they can apply for an away rotation on the when you go to e-learning, there is something called away rotation or away letter. If you apply to that, all of them get accepted, alhamdulillah, and you bring back the university that you completed 1 month in the US, they will reimburse you an extra 1,000 riyals for each month. 1,000 riyal for each month. So that's something to keep in mind. And this is why it's important if you are going to take an elective in the US or anywhere across the globe, make sure you apply to that and go with the rules of the internship office, because they will be able to reimburse you for those electives. If you don't apply to that away letter, they're not going to give you that 1,000 riyals, and in the same time, they may reject that month you did in the US, and they will ask you to redo 1 month of internship.
Perfect. Moving on to the next question. From an IMG perspective, how many years do you think is necessary after graduation for supplemental work like research, electives, exams before applying for the match GS?
You can apply right away, depending
Exactly, I
on your
totally
degree.
agree.
Unless you feel like you need to do a research year, I mean, you can apply right away.
Alright.
Totally agree.
Okay, so the next question, how prepared should I be for electives in regard to surgical skills? Should I take 1 or 2 surgical rotations in Saudi Arabia during my internship to improve my skills?
Go ahead, Abdul.
Um, okay. Sorry, because now I'm like reliving some of the stuff because my brother and I we're in the same year and he did some surgical internship rotations before going to the US. I did not. I was locked in. I knew what I wanted. I want surgery. I don't want anything but surgery. So I saved my surgery rotations till the end of the internship year. So because in the internship, you need to fill out your entire schedule in July or even in June. So you will know your schedule in June before starting your internship. And you're only allowed to have 3 surgical rotations during that year and 1 extra that's an elective. So a total of 4 years, theoretically speaking, that you're allowed to do in surgery. I kept all those 4 to the end. Now, my brother didn't know that he wants to go to surgery, so he used one of his surgical rotations inside Saudi to to see how he does. So, and then he liked it, and then he pushed everything else to the end. So eventually, it worked out for him. If you know that you only want surgery, then do the same thing I did. If you are contemplating, then take the same route my brother did. He used one of his surgery rotations to kind of test the waters. Now, how do you prepare for it in terms of surgical skills or clinical skills? That we have to concede. We have to like say it out loud. Al Faisal University, back when we were students, they did not offer the best, let's say, clinical skills, surgical skills. Um, they were not at the good level that's expected from a graduate of medicine. Whether it's history taking, physical examination, surgical skills, knotting and tying, and even a simple incision and drainage procedures that you do them in like 2, 3 minutes. We were not the best in that. I know for a fact that things are changing. The clinical skills department is expanding, so that's a good thing, but still, it's a long way. So, my advice to you, I think we are most deficient in history taking and physical examination. Um, I'll see if I can send a link. There was this, I still use this video to this day, by the way. It was a guy who's explaining how to take history, how to do a physical examination, and how to present a surgical case during rounds. I think it's very important. I'll look for the link and I'll send it here so everyone can save it.
Totally agree with what he said. Um, but also know that, when it comes to surgical skills, you will not be doing much as a medical student, on an away rotation. And so the way to shine is, to do the basic clinical stuff like history and physical examination and all that and presentation. Um, there's a there is a talk that I did with the surgery interest group last year on how to perform on your electives. If you want to take a look at that, I think it's available on YouTube.
All right, moving on to the next question. Can research proposals be significant in the application, or only publications and abstracts hold value in the area of research?
I mean, it depends on how many publications you have. If it's 0 publications and all of that, and all of them are just research proposals, then Well, I also don't know what you mean by proposals, right? Because proposals, you can't add them to your application. Things that you can add, at least the last time I did it, is things that you've submitted and you're waiting for, you know, acceptance, or they have to be pretty high up in the research, process for you to be able to add them to your application, or at least to be considered by the programs. So, if you have a couple publications and you have a couple of papers accepted or impressed, or I think that should be fine.
Yeah, I agree with Safwan. Nothing to add. I just sent two links. I know they're TikTok videos, but it's the guy that explains how to present a surgical case, like from and how to do a post-op check, essentially because most of the people you will see during your surgery electives are people who underwent surgery. So they will ask the exact same questions that are presented in those two videos. So please take a look at them and save those links. It will help you to have a really good start as a student in the US.
Great, perfect. Moving on, someone is asking, why do all IMG match into preliminary and not categorical, and how to bypass that?
I think it's just that surgery is, it's a demanding specialty, and they would like, for there to be some equivalency in clinical skills from home country to the US. And that's why, a lot of them match into a preliminary position. That being said, it's just a competitive specialty to begin with, right? And so you have American medical graduates who are competing for the same categorical positions. And so it's unfortunate. I mean, that's what I could think of. It's just kind of equivalency in clinical training is why, a prelim year is there in place to balance that out. But that being said, people match into categorical internal medicine positions. But then again, internal medicine is not very demanding specialty. Um, and there are people who match into categorical surgical positions. And so, it's hard to say, honestly. But it's the most likely pathway based on trends. And for people who've matched directly into categoricals, things that they've done is just like multiple years of research, or they've done a residency in their home country, and they're like an attending who comes back to do a residency and stuff like that. So for a fresh grad out of med school from Saudi Arabia, Al Faisal University, I think the most likely pathway is through the prelim pathway. If you're thinking about general surgery, I don't know about some of the other surgical specialties.
Yeah, I totally agree with Safwan. I had one question about can we do electives in fourth or fifth year? Unfortunately, not. Like hands-on electives, you cannot, but you can do observerships. Now, how helpful those are, in my opinion, stay away from them because usually observerships are paid, number one. And number two, it's not hands-on. They will know that you did not put hands on the patient. They know that you did not present cases, even though most places you're called an observer, but they will allow you to do that. But under the premise that it's an actual observership, they will just think lower of it. So if you want to invest in something during fourth year and fifth year, it's going to be step two exam.
All right, perfect. Another question was that directed towards Dr. Abdulrahman. You mentioned that the fail rates of step one have been climbing. Is there a specific reason behind that, in your opinion?
The obvious thing would be because it's pass and fail now. So just because pass and fail and everyone starts saying, oh, they're focused on step two instead of step one, so they study less for step one. Even though, again, I'm re-emphasizing, step one score correlates positively with step two score. Studying well for step one, even if it's pass and fail, will help you a lot during step two preparation.
There's Safwan, do you want to add something? Or-
Nope.
All right.
I-
Um, Another question is that is it better to do electives 2 to 3 months in the same clinic or multiple other places?
As long as you're as long as you're working with multiple attendings and consultants, I would say you should be fine. Because at the end of the day, you were getting letters out of these places. But even apart from that, I would say different places is better because you get to work with, you kind of broaden your connections.
True.
And if I made another thing, so some people they would be only doing general surgery electives. Other would make a mix, like general surgery and internal medicine electives, and they would think, oh, I have a different specialty on my CV. They will think that I'm confused or I'm not so let's say so focused on surgery. That's not true. Sometimes letters of recommendation from a different specialty, it's better looking on your CV than any other surgical specialty because you're going to a specialty. Let's say I'm doing an internal medicine rotation. I want to do surgery. The letters I got from internal medicine are stronger from some of the letters I got in general surgery. Why? Because it's a specialty that I don't like. Even though I don't like it, I did really well and I showed interest. Even though all the people around me in the internal medicine department, they know I want to do surgery. And they mentioned that in my letters of recommendation. So it will look so good in your CV that different specialties are also vouching for you to go into surgery. He showed interest. He did so well. He did not allow the hatred of internal medicine make him do worse in his rotation. So, so sometimes it's actually better to have a letter from a different specialty vouching for you for the same specialty, in this case, general surgery.
Alright, perfect. Next question. How do I decide which elective to apply to? Should I apply to programs in my target state of residency or prestigious programs instead?
I mean, as IMG, you don't have a choice. You just have to apply broadly. You
Yeah.
apply everywhere. Don't look where you want to stay from now. Just go with it one step at a time. This time you want electives wherever they are.
And following up with that, they're asking you if you can mention the places you did your electives in and how was the application process and were they friendly and the fees and stuff, like the
I
environment.
I did I did a month of cardiac surgery at Cleveland Clinic. That was, I think, $400 application fee. And then I did, I forgot, honestly. It was not that much, it was in the thousands. And then I did a month of endocrine surgery at also the Cleveland Clinic. I did then a month of surgical oncology at the Mayo Clinic in Arizona, and then that was also free. And then I did a month of neurological surgery at Loyola University Medical Center in Chicago, and that was $1,700. Um, I should not have done that, honestly, because you know, it's just, neurological surgery. I mean, you should know by now it's a different niche of specialty to begin with. And, just having one rotation doesn't help to apply there. And just that was also kind of a deciding factor for me not to even look into that specialty.
For me, I started with a Case Western Reserve University in Ohio, University Hospital. So that was $300 application fee. Other than that, it was free. Then I did a month in Larkin Community Hospital in Florida. That was $3,000. Another month I did was in Mayo Clinic, Arizona, General Surgery. That was just $300 application fees. I did 1 month in Washington University at St. Louis. That was for free. It was cardiothoracic surgery. And then 1 month of trauma surgery in George Washington University Hospital. That was $7,000. I know that's expensive. However, the highest or the best letter of recommendation I got was from there. Everyone, every single program asked me about that letter and that rotation. So sometimes fancy programs do matter. Sometimes. Sometimes. And my last rotation was a surgical ICU rotation in Cleveland Clinic. and it was for $400 application fees. Or actually, yeah, $400 application and $500 housing, because Cleveland Clinic, they offer housing for all students.
Okay, perfect. Moving on to the last couple of questions. Do you specifically apply to prelim or do they just place you there? And is there a specific application to prelim and categorical while applying?
It's the same application. You just have to click a box that you'll be also applying to the prelim position there.
Okay.
Most general surgery programs, if not all, they obviously have the 5-year categorical positions, but most of them also offer a prelim position in the same institution, and so you just have to check a box.
Right. Okay. Last question. For you to get a prelim in Mayo, were there any steps other than the usual application that you had to go through?
Mm, nope. I mean, it's all standardized, so no.
Right. Does anyone else have any other question? If not, we're done. I think we're done. Right. So thank you guys so much.